Good morning. My name is Mark Baldassare, and I am President and CEO of the Public Policy Institute of California. Thank you for joining us today. PPIC is pleased to have this program on reopening California featuring California Health and Human Services Secretary, Dr. Mark Ghaly. This event is part of PPIC's 2021 Speaker Series on California's future. As a public charity, PPIC does not take or support positions on any ballot measure legislation, nor does it support, endorse, or oppose any political parties or candidates for public office. We'd like to thank our sponsors of this series for their underwriting support. These organizations are listed on your screen and on our website. The series is also funded by the PPIC Donor Circle and the PPIC Corporate Circle, individuals and organizations that provide generous support to PPIC. Please consider joining us as a sponsor or donor so that we may continue to make programs like today's possible. More information is available at ppic.org. So before we begin our program, if you have a question for Secretary Ghaly, please send an email to the email address on the screen and include your name and organization along with your question. ppiceventquestions@gmail.com. We've already gotten some questions and we look forward to having some more that come in. And we'll have time later in the program and in some cases during the program to devote to these questions. I would now like to welcome our featured speaker, Secretary Mark Ghaly. Secretary Ghaly, thank you for your service at this critical time for California and for the US.
Thanks, Mark, for having me, and to PPIC for including me in this important series and an opportunity to talk to so many individuals who tuned in.
Yeah. Well, so let's start with the June 15th reopening, which everybody's very eager to learn more about. From your vantage point, what does the June 15th reopening mean for Californians?
Well, first and foremost, it means that Californians came together over the last year and did incredible work. And let me be the first to acknowledge all of you who've tuned in and all of your neighbors and friends across the state who helped us get to this point. It hasn't been easy. We have learned a lot along the way. But similarly, it's important to acknowledge the tremendous success that you all have helped us achieve here in California. So June 15th means, to me, a big pat on the back to so many Californians for making sacrifices, rolling with the punches on something that we'd never seen before, at least in our lifetime. And there's no playbook and no script on how to do this. So let me start by saying that, because I think if nothing else, that big thank you is important. But for June 15th, it means that some of the restrictions that we've frankly become accustomed to start to go away in meaningful, large-scale ways. They've come off a little bit over the course of the blueprint, but that blueprint for a safer economy, those 4 tiers, that gets retired, that goes away. Capacity restrictions for businesses largely go away. The one exception is what we call large mega events, especially indoors, 5,000 people or greater, where we have visitors from not just California, but across the nation and the globe who may or may not be vaccinated. We want to make sure for a period of time that we require masks there. We are asking people their vaccine status and asking that they be vaccinated. But short of that, it really ends up going away. We announced earlier this week, Mark, that there'll be ongoing masking requirements in certain places, really aligned with the Centers for Disease Control. Places like hospitals and transit and jails and prisons and shelters of a few, and then indoor K through 12 for the time being. But we anticipate in our conversations with the CDC that will evolve. And let me just say it again, that's for indoors K through 12. Outdoors, I sort of say it's the mask-free summer for kids. Give them a chance to get back out there and do the things that they miss. I know that I'm looking forward to that. And then things like the emergency powers, the executive orders that the governor has used throughout this entire pandemic to get us through. Those will start to shift. Many will end. Others will get modified, and we'll be sharing that information as we go. But that's what I think Californians really have to look forward to.
Wow, that's quite a change from where things were at the beginning of the year and certainly a year ago. And I wanted to follow up by a question already came in actually yesterday, and it was from Terry Sforza in Orange County, who wanted to know how the June 15th date was chosen. And I think that's the reason around that is just kind of like, well, what's the logic? Yeah, but maybe you can take us back to that moment in time when that date was chosen, that meeting or however that took place.
I love to, because we don't get enough chance to talk. People think, oh, randomly June 15th, that's sort of the middle of a month. It's before the 4th of July, all of these things. They must have just picked that out of that. No way. We were thoughtful. It came to a couple things. First, we knew we had a sense of when Californians who were age eligible for vaccines would get a chance to get vaccinated, and really all of them. You remember back in January, it was, well, healthcare workers in front of people with disabilities or essential, all of these different conversations on who should be first to get vaccinated or next to get vaccinated. We knew there'd come a day, and we've arrived to that day, certainly, when all Californians can be vaccinated. And we wanted to give a meaningful level of time for people to get vaccinated. So we discussed it and said Moderna is the vaccine with the longest dose difference between first and second, 4 weeks. We knew that it takes about 2 weeks after you're fully vaccinated to get the significant response. And we wanted to give at least 2 weeks for people who were now eligible to get vaccinated to get in line. So we were in the middle of April when this decision was made. We basically fast forward 8 weeks to June 15th and chose it on those two measures. People could get in line and get vaccinated, and we could give a lot of good information to help those who still had questions get vaccinated. And it gave enough time for people to be fully vaccinated. So when things like capacity limits went away, they had a chance to be really protected. And that was the thoughtful decision to go June 15th.
And before we leave that scene, if you can give us a sense about who was, well, it wouldn't be sitting around the table, it'll probably be in the Zoom session at that time.
Well, I mean, it was a number of folks. It was, I had the chance to be there. Dr. Aragon, our entire team from California Department of Public Health, many of my colleagues who I always want to give a shout out to from Health and Human Services, who became real public health warriors in their own regard over the last year. Of course, colleagues from local public health who were considering, how does this work in our own communities as well? We balanced conversations about hesitancy versus access. And then, of course, the colleagues at the governor's office, the governor himself, his leadership team, helping think through what did make sense. We didn't want to be too early, but we didn't want to be too late. So those were the folks around the proverbial table, if you will, making the decision.
Thank you. I think it just really helps to set that context. So here we are 4 days from the date that we've been waiting for, the reopening. What does this tell us about where we are in terms of the pandemic today?
Yeah, I mean, the second measure, when we picked June 15th, we said two things. We chose it around vaccines and giving people a chance, but we said we wouldn't go there unless two things were the case: that the vaccine story played out the way it has, first, and I sort of spoke to that already, but secondly, that we saw and felt confident about the healthcare delivery system to take on what might be coming with COVID, and it has. We are now roughly around 1,000 individuals in the hospital with COVID statewide, still with really good reporting. We haven't seen those levels since the first weeks, not even months, first weeks of the pandemic. So that tells us that vaccines are highly effective, and our healthcare delivery system can take care of the people who become infected and need that level of care, but also that those of us who've been waiting to get other care taken care of can go and get it now, or those who might have trauma or other emergencies come up and they can get the care they want. So those two things came together. And the second piece is really the condition of COVID at the moment. Really, the impact is smaller on our global community in California. I will say, though, there are still some communities that, because of their level of vaccination penetration, have some work to do. We may see some outbreaks. We may see some number of people hospitalized. And so we're going to continue to be ready for that. And one important thing that I hope viewers take away from this is, even though the state is moving towards this June 15th goal, which I pleasantly, I'm looking forward to, just like so many others, we in public health will remain vigilant, right? Mm-hmm. It will be in the background a little bit more, but we will monitor the transmission, monitor the course of the disease, look for the variants. We're sequencing more and more of our positive tests than ever before in California to make sure we track the variants. We know, are these variants that we're really worried about or that the vaccine is pretty successful against? So we'll still have testing capacity. We'll still have all those surge beds and concepts to help us ramp up quickly, all in what we call warm status or the ready position. We still have a team that's going to be thinking about schools and making sure schools are safe, especially in these weeks and months before the youngest Californians are eligible for vaccines. So even though Californians, I think, are going to enjoy globally something on June 15th, we in public health will continue to keep our guard up so we can keep Californians safe in case we see something down the road.
So one thing that I wanted to ask you about the context, about 2 weeks ago, we went through the Memorial Day weekend. And in recent memories, when we've gone through weekends, we've gone through worries, both before and warnings, before and after. If you look at the numbers at this point in time, in terms of having gone through the Memorial Day weekend, what does that tell you about where we are today with the pandemic compared to maybe where we were before the last big holiday weekend?
Yeah, I mean, first off, it tells me to feel really blessed about vaccines and their efficacy and how incredible they've been. And the fact that we see low levels of circulating virus in California. And that is testimony to the fact that we haven't seen many blips, if any, because of that long weekend. And you're right, we had public health people saying, geez, I used to love 3-day weekends and now we dread them because of what it means for transmission. But we didn't see that now. It's, there's still a week or so before we can declare, hey, the impact is really low, but so far so good. And that really does say something about where we are in California. I will remind you though, Mark, that it's a global disease, right? And our success here in California is our success, and we should all be proud of contributing to that. But there's parts of the world that are experiencing something on the opposite end of the spectrum, devastation. And because it's a global disease, the opportunity for variants to spread and be real and to escape the vaccine, something we got to continue to watch. So, all of this is done in that context as well.
Thank you. So as we approach June 15th and later dates, there will be people who feel confused about what they can do when. I'm in our office in San Francisco this morning. When I came up to our office, talking to the people in the lobby and so forth, everybody's wondering, what to do when. And there are so many places that people turn to for information and have gotten into the habit of looking daily for information. So what do you advise people in terms of the trusted sources for state and local updates about what they should be doing?
Yeah, I think first off, it's a really important question. And it's a reminder that California before COVID was really one where we said it so many times, but let me emphasize local control, the conditions for a state as big as we are, right? We have such diversity on so many levels, and we have always appreciated the role counties and county leaders on public health play in guiding the local conditions. And so I always remind people that, yes, at the state, we give these more sweeping guidelines, but your local control does matter. And we end up going to the more restrictive of the two, state versus local. So I remind people, keep looking at what your local public health team and your local leaders are telling you. Their websites, I know, will continue to be updated. The data is really important and the trends, but the guidelines and the rules of the road, if you will, are going to be important. And then we at CDPH will continue to work hard to align with the CDC. So CDPH's website will continue to have what I would say is the true state guidelines, and that will be updated on a very routine, regular basis, especially in the days and weeks to come, so people know. And then the CDC, as I said, we are working pretty closely with the CDC on so many things. So their guidelines are usually very thoughtful and concise and applicable here as well.
So some people have asked regarding the CDC guidelines. We've got counties, we've got the state, we've got businesses setting their own restrictions. Why isn't everybody just using the same CDC guidelines?
Well, I think the CDC and the leaders at the CDC remind me of this when I talk to them too. They say, we know this isn't a one-size-fits-all country. This is and the conditions are different at different times throughout the country. And so giving some real guidelines and rules of the road, if you will, is helpful, but then also allowing us to implement them in a way, to adapt them in some ways, I think is really a thoughtful, and I'm grateful for that opportunity. So yes, they lead us in many ways, but then they allow us to implement differently. And proof to that is their mask guidance came out roughly 3 to 4 weeks ago, and we chose here to wait to implement them completely until June 15th, so we could give people time to prepare both emotionally for what it meant, but also operationally. So that's why they do that.
Yeah. And for some people, the fact that we're reopening and at the same time have an ongoing state of emergency has led to some confusion as to where we are in the pandemic. And I wonder if you could elaborate on the state of emergency, what it means, when it'll be lifted, and what will it take to get out of that state of emergency, which is alarming to people, obviously.
Yeah, and I'll just remind people that we've had other emergency situations in the state. I mean, wildfires, big fires that we've had impact communities, and the state of emergency stays in place well after the fire is out. And that's to allow people time to recover, to get the resources in place, and that's no different here. So this is not actually an unusual situation where even though the temperature on the emergency is decreased and its impact on people's everyday lives is different, but some of the aspects of the recovery phase. And then I always try to remind people that, look, we still don't have every Californian eligible for vaccines. Right. I'm a pediatrician. I'm a father of 4. I have an 11-year-old who I wish were 12. Yeah. So I could get him protected. Right. But so there is a part of us that we still have a big significant group of people who need to get vaccinated, and we look forward to that happening in the fall. But the biggest reason is this is not actually atypical to have the emergency run longer than the sense that the fire is still flaming, and that is the case here. So I hope Californians aren't alarmed by it, but look at it as an opportunity for us to continue to support our recovery in many ways. Do
you have any sense about how long or?
I don't. I mean, this is a conversation that is one that's obviously local, but also we have some federal conversations to have. And some of the emergency orders, or the EOs as we've called them, those are going to be discussed even later this afternoon about their fate. So there's a lot that's going to be shifting.
Well, that's good to hear. You mentioned vaccines, and a number of times, obviously, this is the big the big discovery that made things possible to be where we are today. I wonder if you can tell us, from your perspective, where California stands today in terms of its vaccination rates. How are you thinking about that?
Well, I think, look, we want it to be as high as possible.
Mm-hmm.
It is not, we would love for all Californians to make that choice to get vaccinated, but we're also realistic about a number of people who just, aren't interested. They don't see it as the way for them. And we have made a tremendous amount of effort with great success to get people who might have stayed on the sideline longer had they not been given the personal attention, answer their questions, knock on their door, make it convenient and easy, bring it together as something that people who are speak like them, look like them, live near them actually do. So I think I'm really proud, and I'm proud of our state team, but I'm so proud of the leaders across healthcare and public health in every nook and cranny of California who've done a tremendous job getting to about 70% of eligible Californians to get that first shot at least, and many who are fully vaccinated, gives us this level of protection. And on top of that, Mark, unfortunately, we did have a lot of Californians infected. Yeah. And that, natural immunity from infection is important now, but we are worried that that will wane and we'll need to continue to be ready on vaccines. So one thing you're giving me an opportunity to say is I do believe that as we see in counties, I was on with one supervisor just a little bit ago in a county that has a pretty low vaccine rate. And I told him that, you're going to see some outbreaks, and it's at those moments of an outbreak that we need to be ready to vaccinate additional people. Yeah. So I think some of the success that we're seeing with vaccines is part of the reason why some others are saying, I can wait a little longer, and we want to be ready when they change their mind to vaccinate them. But I'm overall really proud of where we are and just grateful to people like Secretary Yolanda Richardson, so many people across state and local government who've made this possible.
So when you look across the state, from an equity perspective, where are the gaps that you are most mindful of needing to fill in terms of vaccination rates now?
Yeah, I think we've talked about our, we've called it lower quartile, quartile 1. This is the Healthy Places Index that looks at a composite set of measures that starts to really define communities as it relates to COVID that have been harder hit versus those who've been routinely more protected. And it falls along socioeconomic lines, racial lines, opportunity lines, all of those things. Many of your viewers are not going to be surprised. This is why today health equity or inequities, it's a household phrase. It's no longer just for policy wonks or program wonks like you and I, but for everyone heard it. And so the opportunities really lie in those quartile 1 communities where there's still a lot of questions. We still can do some work to make it more convenient to get people vaccinated, where people want to see their neighbors who did get vaccinated live to tell about it, earn the benefits from that. So there's still work to do, and Latino communities, especially in quartile 1, African American, Black communities, Asian Pacific Islander communities. What we loosely talk about is the brown and Black communities of California, which are thankfully enormous, right? A big state of many colors, and we want to keep doing that work. So that's where the gaps are, and that's where the focus has been, and we've made tremendous progress, but still more to do.
Thank you. So, there's a lot of reason to be, optimistic about where we are in terms of our vaccine rates in California and where this allows us to go. One of the questions people have now is about this notion of vaccine verification. We're not going to the passports. That's at least in the U.S. Whether we need them when people travel abroad, a whole other thing. And I've heard recently, and I think you talked about the honor system lately. So as we move into the reopening, how do you see the process of vaccine verification playing out?
So in general, the state, like the federal government in so many states, have not moved towards that vaccine passport concept. We're following the conversation very closely, again, talking to our federal leaders as well about it. But we're also very cognizant that we'll see apps on our phone, things created so that those who want to have their vaccine verification on their fingertips, they can have it, and there'll probably be developed some real thoughtful applications of how this can be done. And we here in California, and this will be coming out shortly, will be putting out some ways to do this responsibly, so that folks, you know, we worry about discrimination, inequities, limiting access to folks. We also want to make sure that we remind people that sharing your vaccine status, if that's your desire, is somebody's personal prerogative, and they should be protected and be able to do that seamlessly. So we'll be putting out some, what I like to say, some not guidelines or rules, but really things to consider. So if that business owner decides to do more than post a sign up with the requirements, offer people who maybe forgot their masks, who are unvaccinated, a mask, but people who, those business owners who want to do more and verify, we'll give them some guidelines. And I expect there will be some business owners or some places that say, for the next few months, we're gonna say this is only for people who've been vaccinated, and we're gonna use one of these responsible ways of verifying. So we're working on that and giving those operators and owners some of that guidance as we go.
Do you expect that we'll be seeing that before June 15th?
I think some of the concept, we're doing everything we can to get it out before then, certainly. That's my expectation.
Yeah, because that's obviously an area in which people have a lot of questions for the vaccinated and the unvaccinated. So tell us about your thoughts around having an honor system in this public health arena.
Yeah, I mean, remember, we in public health, we've always depended on harm reduction principles, giving recommendations, giving guidance, and then working with our communities to implement them thoughtfully. And so having something like the honor system, if you will, and that's what many people have begun to call it. We talk about it as self-attestation, that you are actually attesting by either wearing a mask or not wearing a mask in this case, whether you're vaccinated or not, that with the right level of information, it can be an effective, easy to implement tool. Remember, one of the things we never want to do is create additional sort of conflict and strife in the world of leading our everyday lives. So this is one form, as you put it, the honor system. I think that it will be generally effective. But of course, when there's the honor system, some people will do what we will say is the wrong thing in this case. They'll decide to go into a venue unvaccinated without a mask for one reason or another. And the good news is, with the low levels of transmission at the moment, that it still will likely be okay. And we're going to watch this closely. And if we see rates change, we'll certainly remind people of the message as we go along.
And one of our audience members, so I'll put the question in here now because it's most relevant rather than come to it later, says, why not have a California vaccine passport to make it easier for businesses, individuals, and event organizers to know quickly if an individual is fully vaccinated?
Yeah, I mean, it's a good question. We've thought a lot about it and have decided that in many ways that will be not local government necessarily making that decision, but we believe local business owners and entities making that decision. And if they do, we also know that over the next many months, that there will likely be easy to use electronic and paper-based ways to do that verification. So the state isn't required to help that happen. We think it will happen on the natural, and those owners who think it helps them run their business better, maintain a sense of safety for themselves and staff, will choose to do it.
Thank you. Just for everybody in the audience, I want to remind you, in 15 minutes, we'll start our Q&A, and here's the email that you can send to Mark and ask him any question you might have about the reopening of California. I want to turn to something that you mentioned in passing earlier, which was that with the COVID variants, and we read a lot, we hear a lot about the variants in other countries, and some of them have made their way to the US. As the economy opens and as we have more and more people traveling, coming in and out of California from different places, how concerned are you about COVID variants becoming a health threat in our state?
Well, so the first bit of good news is that the vaccines are highly effective to our existing variants. Yes, there are variants that are more infectious, more virulent, but we haven't yet seen a vaccine or a variant that totally breaks through our vaccines, which is great news for the time being. But I go back to the comments about this being a global disease and why we need sort of our version of national security system around COVID, that we have to keep our guard up on this because we don't know what's going to happen around the globe. The way variants become sort of pick up their own steam is through transmission. So when we don't have a lot of transmission here, we're making our global contribution to reducing the likelihood of a dangerous variant. But when we look across the globe and we see other nations that are hard hit and don't have the luxury of high vaccination rates, those variants will, if they become resistant to vaccine, they'll make their way to California and the nation, and we'll have to keep our guard up to that. But so far, we haven't met one that does, and that's why I remind you for almost the third time here that we're going to keep our guard up. It doesn't mean that we'll have restrictions and daily life will be impacted, but I think Californians want us to keep our eye on what's happening, and that's what we'll do.
A lot of people also want to know if we're going to need boosters, and when do you think we might need boosters, and what are your thoughts around boosters?
Yeah, I think there's. I think about boosters really around two different possibilities. One is the idea that immunity wanes from vaccinations eventually. We see that as a pediatrician. We have boosters for a lot of childhood vaccines for exactly this reason. After a couple of years, you see the immune response, it needs a boost. Literally, it just needs to be fired up again, and then that's good for an even longer period of time. So one wouldn't be surprised if, like so many other vaccine preventable illnesses, we end up needing a booster. We just don't know really when, what that looks like. But if you see a booster need because of waning immunity, it's a very different thing than if we see a quote booster because there is some threat from a variant. And that's a totally different animal, if you will. So we'll be looking at both. And when you ask, well, what's the likelihood? I pray that there's no it's very unlikely that it's the variant problem. But the reason to get a booster, we'll see. And I'll just say for all Californians, we feel ready for that. We feel like we've made this transition from mega vaccine sites to having it be part of the healthcare delivery system in a way that if we need vaccine boosters, we'll be able to do it through that method quite successfully here in California.
Good. And just to clarify, the waning immunity means that the 2 shots that we had, they last a certain amount of time, as opposed to a new variant, meaning that you need a new kind of vaccine because you've got a new threat that is not part of the portfolio, so to speak, of what this vaccine provides.
Well said. Yeah, and the waning immunity issue is one that's common with many vaccine preventable illnesses.
I want to turn back to schools because schools, obviously, during the pandemic, has been a big issue, really for everyone, particularly for the parents and the students and the teachers and the people who work in the schools. And in a recent survey, 6 out of 10 Californians said they were concerned that schools will not be fully reopened this coming fall. What's your outlook about school reopenings for the next year? I know that you're not the head of the Department of Education, but you can give us a perspective as the Health and Human Services Secretary.
So, as both the Health and Human Services Secretary and then pediatrician and father of four, this is a big question, and I felt the impact very personally. And just remind you that the impact on parents and work and education is one thing, but the growing understanding of its impact on broadly child health, young people's health, behavioral health, mental health. We're just scratching the surface in our understanding there. So this is what I would say a very important area that we will not only plan around, but think about for a long time. And let me just be clear, our intent is to set up a situation where all kids can be back in California to full in person in the fall. Mm-hmm. And that's the goal, even this summer for schools that are starting in the summer, and that's just weeks away. So we're working hard with the CDC to make sure we understand the evidence behind some of their recommendations, how they apply here, and grateful that so many of the older, most vulnerable kids from a disease perspective now can be vaccinated. So all of that sends us down this road of we need to set this up and provide all the public health backing and strength so schools can go back for so many reasons. We know that it's more complicated than just a health consideration, but I think the governor has spoken, the legislature has supported this idea that the expectation is kids are back. And I hope every parent hears that and does what we need to do to prepare to get kids back for the fall so they can enjoy what they've missed for so long.
Mm-hmm. And do you think it'd be under the conditions of wearing masks, social distancing, capacity limits? How is school going to be different?
Yeah, I think it's a great question. And when we talk about kids 100% back in in-person education, that means something from the physical distancing capacity limits. That means we're looking forward to not having a capacity limit that all kids could have the choice. That means that you can't have 6 feet of distancing, right? We'll see how that all ends up in our conversations, but those are two things that I think couldn't happen in order for us to achieve the goal I laid out. Now, masks are, an important part of the conversation. We're seeing the evidence evolve. Again, talking to the CDC about what they're seeing nationwide. And we also know that if the state doesn't itself have the requirement that all kids, maybe younger kids, all kids in school are masking, that some local school jurisdictions, local health departments may make that decision. And this is where I come back to, California is such a diverse, an amazingly diverse in all the ways amazing that you can be, diverse state that has a bunch of unique perspectives, and being able to allow some of that to now sort of not dominate, but really take shape, I think is important. And Mark, you and I were talking about some of the things that I've had a chance to experience from this. And one of the things that I've been so grateful for, and schools as part of this, is just the difference between the urban counties that I've had the pleasure of living in largely, but some of our rural counties, and the appreciation for some of those differences. COVID doesn't care if you're in one county, in Siskiyou in the north or San Diego in the south, but I understand that some of this does kind of get reflected through that lens, and I've appreciated a chance to learn all of that as well.
Yeah. And I want to follow up on an earlier comment you made about the state's early emphasis on equity and equity metrics to prevent illness and save lives, given that this was a disease that was impacting communities of color and low-income communities disproportionately. Can you give us a sense of how you now view racial and income disparities in California maybe differently in terms of either health or the healthcare system than you might have before this started? Or is this pretty much happened the way you would expect, as somebody who had this training?
Yeah, I mean, nothing has been exactly the way we expected, but very early on, I think public health colleagues were attuned to the fact that we would see these disparities really come come to fruition in a very sad and impactful way for certain communities that are based on things we've worked really hard to not have outcomes
Mhm.
based on race, ethnicity, socioeconomic status, immigration status, where your family came from. But we saw it in the realest, hardest ways. If you could afford to stay home, order food, have things sort of done for you with an arm's length, literally 6 feet apart, that you were generally going to be safe. But if you didn't have that option because your livelihood didn't allow it, you were vulnerable in a way. And I always think about, I've had the privilege of working on so many different issues around inequities in healthcare, whether it's directly in the delivery system or on homelessness and justice involvement or in child welfare, all of these important areas. And on housing in particular, like I didn't know California actually has, I believe it's 9 out of the top 10 most crowded living conditions
Yeah.
are not 9 out of the top 10 cities in the whole nation are here in California, mostly Southern California. What do I mean by that? Those are more people living per bedroom than any other state. So it's not the San Francisco crowdedness where houses are next to each other or there's lots of apartments stacked on each other. That's fine. But it's actually within the same unit,
Mhm.
lots of people living in the same bedroom, sharing the same kitchen, which is really a reflection of where we are, not just on health, but our entire system. And something that I look at the governor's budget and his proposal around the comeback plan and these investments. I think we make a lot of investments in some of those structural features
Mhm.
that drove some of the inequities. So I'm really proud of being here at a moment. Not proud is the wrong word, but really grateful, honestly, to be here in a moment, to be at that table to help guide some of these future investments that I think will accelerate our progress on thinking about inequities differently. So not so much am I surprised by what we saw, very disappointed that we couldn't do more, but
Yeah.
I think the opportunity to change this for the future is a real one given the kind of resources we currently have in the state.
And so what lessons did the pandemic hold for you in terms of how we prepare for and respond to our next public health crisis?
I think first and foremost, we need to continue to make headway on lifting all boats. Some say I've always been interested in working on the quote safety net, and I actually visualize a net, and I see a net with holes in it.
Yeah.
And I've always thought about my job as being someone who's going to try to tighten that net up and fill the holes. I
Mhm.
now also see the responsibility to widen that net
Mhm.
and to lift it up. And the lift up is really important. And what I mean by that is we often let that safety net live pretty close to the ground.
I see. Yeah.
And lifting it up gives us an opportunity to allow people to get services and resources before they nearly hit the ground.
Right.
And so when I look to the future and I think about the learnings, it's how do we commit ourselves to lifting up the net, not just tightening it up or making it wider, because I think that then creates opportunities for additional self-sufficiency and really living the dreams that so many Californians have but don't get to live for one reason or another. So I look forward to working on all of those issues and learned a lot about thinking that through over the last many months.
Let me ask you, before we turn to a couple of other audience questions, what have you learned about telemedicine during this time?
I mean, first off, I learned that healthcare can be nimble.
Hmm.
Right? We always accused it, and I was chief among them. There's no way we could do that. But when push came to shove, and I just thank all of those colleagues who dealt with the lack of comfort and went from 8% televisits to 80% nearly overnight. So, I mean, we learned that healthcare can be nimble. We learned that it's really helpful in some areas more than others. And as I think about our behavioral health challenges and the crisis ahead, I'm so grateful that we learned what we did about telemedicine to be able to scale some things that we thought we could never scale. When the only option was train more people and convince them to live in areas where they don't have providers, when that was our only choice, we were in trouble. But now that we can actually connect with people thoughtfully in a highly, productive and private way, we think that this is a tool that we are only seeing the beginnings of its benefit to us. So another place where I look forward to seeing how it works, but I commend people in healthcare for turning on a dime, frankly, to do it.
Yeah. And oh my gosh, there's so many I have a million other questions that I'd like to ask you, but I do want to turn to some of the audience questions given the time we are, and again, encourage anyone else in the audience who wants to send questions, please. This is your moment. So here's a question from Sheila James, Office of the Assistant Secretary for Health, OASH Region 9. Why not a vaccine registry for all vaccines, including COVID? We've had vaccine registries in the past.
So, thank you for the question. And we've had the California Immunization Registry for quite some time. I used it in my personal practice. I was grateful for it because before we had it, we had to put together a bunch of yellow cards and pray that the dates matched up, and we couldn't tell what was that signature and what was that date to determine what young people needed to be up to date on vaccines. California Immunization Registry gave us this chance to have that electronic. It wasn't perfect, but it was pretty darn good and a major improvement. We've since invested, because of COVID, in what we call California Immunization Registry 2, a lot more widespread, deeper expectation to have that available. So many more vaccines, we think over time, including the COVID vaccine, will be fed into that registry. We're now making some efforts to allow people to access those records when they need them in more convenient ways. So thank you for that question. And I would say we're working on it.
Okay. Thank you. Here's a question that came in earlier, and I want to make sure we get to this too. What is the state of California doing to keep its case investigation / contract tracing workforce intact for local health jurisdictions in the event it's needed if there's a COVID-19 surge or other outbreaks in the near future?
Yeah, I mean, this is part of the key question, and I'll just try to say it more clearly. June 15th means a lot of things change, but not our vigilance. And the contact tracing, disease investigation, and outbreak investigation and management is going to be top of mind. Thankfully, we don't expect to have 3,000 or 30,000 cases a day moving forward. So the level of effort should be sufficient to stay on top of it, and we will. The state will continue to provide some support in that area. And we know local health jurisdictions have done a tremendous amount of work to build that up. And especially as the vaccine work starts to normalize, some of those individuals who are used to working on contact tracing, disease investigation will get their day job back, if you will. And so we'll look for it. But if we see gaps, California is committed to filling them, and we know how now.
Thank you. We're getting a lot of good questions today. Michael Gazzoni, counsel for the County of Santa Barbara. Since counties and cities are controlled by guidance from both CDPH, that's the California Department of Public Health, and CAOSHA, can you discuss any expectations about next steps by CAOSHA and on or after June 15th on the topic of face coverings and distancing indoors?
Michael, thanks for the question. And if it didn't come up, Mark, I was going to get to this in a moment.
Okay.
So we know, and first off, let me thank CAOSHA for their tremendous work and leadership throughout this entire pandemic. workplace safety is their business, and I'm grateful to have them as partners in thinking through this. Their entire team is thoughtful and fantastic. They have independence. They have an independent board that considers the emergency temporary standards, which I think Michael's referring to. And they have made some decisions over the past few days, first to move in one direction. And then because in part, I think we've updated the CDPH mask guidance, they're now reconsidering, and I think soon we'll be posting their next draft for consideration of the guidance moving forward for employers. They have two standards, the emergency temporary standards, and then the ATD standard that applies in certain specific workplaces. But their role, their independence, I appreciate and respect. Always look forward to sharing what we know and what we think at CDPH, but allowing that. So we'll see what comes, but I do believe that they will be coming out with something soon that we'll all get a sense of where we're heading over the next couple of weeks with workplace protection and masking.
So for now, I will continue to have my mask next to me at work. So you think maybe before June 15th or thereabouts?
I'm not,
yeah.
I have a lot of things that I'm responsible for. That date is, I think, on
Right.
somebody else's watch.
Exactly. Here's an interesting question, and maybe you want to kind of describe the context behind this, but when do you estimate that California will achieve herd immunity?
Yeah, I think the first question is, what do we mean by herd immunity?
Exactly.
With
Right.
COVID?
So what do you mean by herd immunity?
Yeah, I mean, I think I like to talk about community immunity or community protection, because that's what we're really talking about. We're talking about if you have a community that is so protected that a case of COVID comes in, but doesn't create a threat for widespread spread, that is, to me, the protection that we're trying to achieve. When do we hit that? I think the hard part in answering this question, and I know so many people want a number, is it 70%? Is it 75? We've heard some people say 80. The tricky part is we both benefit from the vaccine-related immunity and, as I said, natural immunity. And we still don't understand which is better. We think we have good sense that vaccine is better, but we don't know how much better. Will that natural immunity wane sooner? So the level of protection is hard to pinpoint. And that's why we say every shot counts. Everyone who gets vaccinated not only protects themselves, but takes us one step closer to community immunity. So this is going to be a hard one for anyone to reliably answer, but I think we know the right direction is, let's work on getting our neighbors vaccinated. Let's work on getting ourselves and our families vaccinated. So whatever that threshold really is, and we may not know for quite some time, we know we're taking steps to get closer to it, no matter where it is.
And related to that, as you think about the summer, between July 4th and then Labor Day, and then after Labor Day, last year there was a great deal of concern about there being a surge in the fall and winter months. And how do you think about that now?
Well, certainly feel that it's less and less likely. But I do know that there's some communities, I mentioned the one county where they had a pretty low vaccine rate. I don't know what their natural immunity rate is. I will check later now that I know that that county's situation is what it is. But I think those things matter. So we're going to see outbreaks. I have no doubt that we'll see some places that are unvaccinated largely that are going to have an outbreak, and that's going to have real consequences for people. But I don't think we're going to see over the next many months, given the efficacy of vaccines, an enormous surge in cases that we saw before. But that doesn't mean we're not going to see the important individual impact on people because of COVID. COVID will find you if you're unvaccinated. It is sneaky like that, if you will.
So another question coming in from the audience. So you're traveling around the state, you're talking to a lot of county health directors. Are there any common challenges or concerns at the local level that you're hearing from the county health directors, from the leaders at the local level?
Yeah, I think there's, like I said, there's such a diversity, and this has been the case among health officers. So there's not a single theme, but you do hear many of our rural counties really wanting to have some additional flexibility and control over the conditions there. Some of the more urban counties wanting us to be thoughtful about taking off the mitigations, but really being thoughtful because of that crowded nature of some of the living conditions, the fact that vaccine work in hard-hit communities is still ongoing. So you see that diversity. I would say if there's a single theme, people want, as we recover, for us to be really kind and tolerant. I think people are going to recover differently, and I certainly share this in my head and heart, that I hope that we honor people's choice to wear a mask longer than maybe I think they should, or you think they should, or to wait a little longer to get vaccinated because they have questions. Like, I mean, I want to see them vaccinated as quickly as possible, but if they have questions, so all of that, or if they feel like, hey, this isn't for me right now, and they're screaming up and down about that. So just how do we, in this very vulnerable time where this mix of excitement and vulnerability is still the truth in the state on June 15th and a little beyond, how do we continue to exemplify that kindness that I think is one of our core values, but also that tolerance so that people can sort of adapt as they see they need to. And I hear that as a common theme among health leaders, that they don't want to see this more politicized, more polarized in a way as we come out.
And I wanted to follow up on the issue of that. There was a question that came in about would you support Governor Newsom around workplace mask requirements? But let me broaden that question to just because obviously you were appointed by Governor Newsom, but give us a sense of what it's like to work with Governor Newsom on COVID. For you,
first up, and a sincere comment that it is a real privilege to work with somebody who I think has really wanted and been thirsted for the science and the evidence, and he'll push and ask questions about certain things, not towards an outcome, but really to make sure that we've kicked the tires on things. And I've been very grateful for his really intelligent work and close work on this. There's been weeks and months where there's daily conversations and lots of not just texts and emails, but let's get on the phone and talk about this. And I can't imagine that every governor across the nation has done the same. And I've been very appreciative as a voter, as a citizen, but also as somebody that he asked to work with him on this, to be able to have him led and guided by the science has been really refreshing and comforting for me and the role in our team.
And you mentioned earlier the politics and obviously the polarization in our country today, and the governor's facing a recall in 2021. What's your reply when people say that politics are behind the June 15th reopening?
The governor and I talk about COVID, and we made that decision, and I hope I gave a very candid but really clear response to how that is driven by what we thought we could prepare to do. And so, and the good news is it has played out that way. And so I think the evidence behind where we are supports that June 15th decision in many, many ways. And I trust that we'll be watching things closely moving forward, and that our governor will continue to keep the safety and well-being of Californians front and center in our conversations before June 15th and well after.
Do you get to talk to Dr. Fauci? Do you get to talk to U.S. Health and Human Services Secretary Becerra?
Yeah, so I have the privilege, the position comes with it. Dr. Fauci and I have certainly exchanged a lot of calls, a lot of texts. He's asked me, Mark, why are you doing this? I explain it. He gives a little advice. I feed into how he's thinking about it. Dr. Walensky at the CDC also has become a new partner and somebody that I certainly have the privilege of accessing on a regular basis. And then, of course, our friend and partner, the Secretary of the U.S. Health and Human Services, Mr. Becerra, have the chance to talk to him about COVID and other things in this recovery. So all good partners, and they acknowledge the role California plays in the nation.
I don't know where the time went today, but it's gone. And before we close, is there anything that you want to say that for Californians to take away about the state's reopening on June 15th before we say goodbye for now?
Just again, and how I started, thank you. It's been a pleasure to be in this role, but thank you for all that you have done, every one of you in California, to help us get here.
And I'd like to thank you, Mark, for joining me today on this program.
Yeah, my pleasure. Thank you, Mark.
And I'd like to thank, again, our sponsors and for all of you for joining us. Later today, you'll receive a survey. We hope you will join, will let us know how we did. And please be safe, have a good afternoon, and thank you.